Today I'm doing sclerotherapy. Sclerotherapy is where we can help get rid of spider veins. So if you have any blue or little red veins in your legs, we can actually help to close those down. The way that veins work is their function is to push blood up to your heart. So there's valves in the deep veins that close to help push your blood up. Now, if those valves break or they become insufficient, if you get venous insufficiency, then your body needs to figure out a different way to get the blood up. So your body makes new veins, and that is what becomes your spider veins. Now, the way that Asclera works, which is polidocanol, it is an irritant. So it irritates the blood in the veins, it irritates the blood vessel walls, and that all gets stuck together. So your body goes, ooh, that's hard for blood to go. Your blood says this to itself, I can't go through that vein because it's pretty clogged. I'm going to go deeper. And so eventually your body stops using those spider veins and goes back into deeper other veins to get back to your heart. And then your body generally eventually absorbs those little veins. So it takes anywhere from 3 to 8 treatments. National average is 5 to get rid of spider veins. So it's not a one and done. And after the treatment, I will recommend that our patient walk a little bit, but I don't want her doing anything that's really going to get her heart rate up and dilate those vessels that we just tried to shut down for at least a week. So no marathon training, no aerobics, so she can do things that are nice and easy that aren't going to get her veins dilated. And I would love for her to wear a hose, compression hose, typically 20 to 30 millimeters of mercury, not those white hose that they give you in the hospital because those are generally like 5 to 10 squeeze, but the hose that I recommend are 20 to 30 millimeters of mercury, generally however high we're treating the veins. So our patient's veins end like right above her knee, so I would recommend that she get the knee high ones, and she should wear them for the next 7 to 14 days while she's upright. So she doesn't need to wear them when she's sleeping or she's sitting around at home, which I'm sure she never does, with her feet up. She can put her feet up, but if you're up and about, then you should be wearing those hose, and it will just help this treatment work better. So I am going to go ahead, I've already wiped her down with some alcohol, we'll wipe her again, and I'm going to start down here. Okay, so ready, 1, 2, 3. So I recommend coming in every 2 to 3 weeks until those veins are gone. And so we're just going to keep on going with, let's go this direction. You can see a whole bunch of them, just look at that travel all the way up, went all the way up to here. Isn't that great? I love that. It's a feeder vein. Let's go up here. Oh, it's so fun. Look at that, it's beautiful. Awesome. Polidocanol is the standard of care for varicose veins. You can do laser if they're really teeny tiny and you can't get a needle into them. Sometimes laser is better, but this is the gold standard. So I like to at least start with a couple treatments of this. Definitely for the bigger veins, definitely for the blue veins. And then if there's some that we can't get, then we'll go to laser. Oh, look at that. So fun. So fun, I know. I'm having so much fun at your expense. Okay. Let's go down to this guy down here. And this is just a little 30 gauge needle. Ooh. If you have bigger, really ropey veins, I would recommend seeing a vascular surgeon first, because you might need to have something a little bit more invasive than what I'm doing with just trying to sclerose them. So vascular surgeons can do ultrasounds, and then they can tell you, oh, you know what, you need to do surgery on these, or internal laser, or they'll say, oh, you know what, just keep doing, sclera. So again, if they're really ropey, that's when I recommend doing that. But these are perfect veins for this treatment. Oh no, I did an awfully good job. Okay, I'm gonna have you turn a little this way. Perfect. Get this guy ready. 1, 2, 3, boom. You okay? Yep.
Okay, good. Awesome. Beautiful. We always want to inject them distal to proximal, so the blood will help carry the Asclera up, which is nice. So we'll let the veins work for us in treating them. I think that looks pretty darn good. Oh, there's a couple on this side. But in general, I think you get the idea of how this works. If you want to find out if Asclera, sclerotherapy, or any of the over, 60 procedures, 70 procedures that we do at Rejuvenation MD are right for you, you can find us on YouTube, Instagram, Facebook, or online at our website at RejuvenationMDmedspa.com.